All right, good Sunday afternoon. Good Sunday afternoon. There's no time for any music or any right off the bat. Let's do some trivia questions. It's been a lot of things going on here. So I'm coming to you on a Sunday late afternoon, almost evening time, just to talk a little bit about South Texas Surgical Hospital. As of yesterday, okay, folks, as of yesterday, officially in our back parking lot, it is now called Christus South Surgery Center. So that back parking lot, that building over there that we really don't pay much attention to, well, guess what? That is part of Spawn South now, okay? Part of Spawn South. It's a full-fledged hospital. They have an ER. They have 11 OR rooms. They have a second floor that has, I believe, up to 25 beds and what have you. So with that being said, what does that mean for us? Nothing in radiology just yet, other than you're going to see, I can't show you the personal information, but from time to time, until they fix certain things, you might get a request that's going to print and you just can't find this patient because Christus Surgery Center, right across the parking lot, is using AV dot, is using MV dot, is using RadX outpatient imaging. So it's going to get a little confusing. So if you look at, if you open up McKesson PACS, right, soon to be Sectra, if you open up McKesson PACS, you might see some cases on there like, wait a minute, that's not our case. Right now, because we kind of had to, with a sense of urgency, give them Meditech access and PACS access. We basically, it's an extension of Spawn South Radiology. Some reports are probably going to print over here. I mean, not reports. Some requests are probably going to print over here, and you can't find them. Don't spend too much time if you can't find them. Just another slot. We got one for NCC. Let's get one for Christus Surgery Center. So we'll come up with our own name for it, but just put it in that slot and then bring it to my attention because they're going to be looking for their request too, folks. I believe they have 4 technologists over there. Okay, 4 if not 5. 4 of them. Forgot all their names already. Michelle, Joy, but nevertheless, they have about 4 employees over there and 3 C-arms. Okay, they have 3 C-arms in play. A Trident, hologic Trident specimen unit, also known as the microwave. It's really updated. It's really nice. And they have 2 mini C-arms, the old mini C-arms. Don't get excited. The very old mini C-arms, a chest room, and 1 CT scanner. Okay, so with that being said, it's they don't have nuclear medicine. They don't have an MRI machine. They don't have a fleet of portables. They do have 1 portable extra unit, but nevertheless, their volume doesn't. I mean, they do a lot of OR cases, a lot of total hips, a lot of total knees, a lot of IOCs, a lot of needle lokes. So they're a very busy surgery center. That's what they are. So with that being said, folks, we welcome them into the Christus family, but more specifically, the Christus South family, because now they're right across the parking lot. They're going to share everything South, AV, MV, and until we get some force print and Meditech to basically keep that from happening, trust me, Tony and Aman have been working very hard. I think Friday past midnight up until 3 a.m. Sorry, Tony, hope you don't mind me sharing that, but Tony was on site over there getting their CT hooked up to PACS, getting their portable hooked up to PACS, getting their 3 C-arms hooked up to PACS and Meditech worklist. They worked very hard on that. So that's the big news. Okay, folks, Christus South Surgery Center is the official name, okay? South Texas Surgical Hospital was their previous name. So with that being said, Jennifer and Joy came over just to get some in-service with our PACS, because now they're having to learn a whole new PACS system. They're having to learn a whole new Meditech system. They have Meditech currently, believe it or not, but they don't have all the bells and whistles. That's going away soon, right? We're switching to Sectra, and we'll be going to Epic in that regard. So nevertheless, you might see some unfamiliar faces come over here and train just to get some more PACS training and scanning, paperwork and what have you, and Meditech. So we will basically, they are our co-workers in that regard. So with that being said, more to come on that. We'll have some little topics here and there. Let me see. Birthday shout outs. We're in April. We are in April the 2nd. Okay, April the 2nd here. Birthday shout out to my wife. Happy birthday, honey. And I'm home here at work, but we already celebrated. We already celebrated there. So anyways, let's see. Who do we have? For March, AJ Pettis, happy belated birthday, March the 6th. We talked about this. Lynn Marwick already. That was in the last YouTube huddle. Chris Cardona and Caitlin on 316. Okay, so we did the March shout outs already. But since we're in April, let me get current, okay? Let's talk about April birthday shout outs. Rosie, 415, April the 15th, tax day, close to tax day, right? Angie, 427, so not even happy belated birthday. We're gonna be doing another birthday shout out, trust me. Katie, April the 28th, Laura, April the 27th, and Amy, April the 17th. So nobody's had a birthday yet. That would have been a great trivia question, right? In that regards. All right, folks. We'll do April birthday shout outs in a couple of weeks again, all right? So we need to welcome Andrea. Andrea Lundquist has been with us, I believe, 3 weeks now, if not, maybe 4 weeks. Get on the group chat and let us know how many weeks you've been with us, Andrea. But Andrea Lundquist, welcome. You've been a wonderful addition here. Thank you so much. Appreciate you. Sarah Martinez literally has only been with us 4 shifts, guys. That's it. Just 4 shifts. That's it. 4 shifts. So we're talking brand spanking new to Spawn South, the Spawn Way. So welcome Sarah Martinez, our mid-shift, evening shift technologist. She's going to be coming in, overlapping some day shift hours next week. And again, it's kind of a cultural day, which is Good Friday. With that being said, so she only has another 4 shifts. So we'll get her we need to get Sarah a good full 2 weeks of some additional orientation here. But so this past week was just orientation on a Monday. We all been through that. And then she's only had 4 shifts with us. So we're going to rev up the orientation again and the training. So she's coming with some overlapping shifts Monday, Tuesday, Wednesday, and Thursday. And of course, then it's the Good Friday. So welcome, Andrea, and welcome, Sarah. With that being said, folks, just so that there's no confusion, because I know there is confusion, Good Friday is considered a cultural holiday. It's not an official holiday. We're treating it as a holiday, but it's not holiday pay. When is holiday pay? Easter Sunday. So if you're on staff from midnight to midnight on Easter Sunday, that is holiday pay. This Friday, admitting is closed or is open. Go figure, all right? So it's going to be treated as a holiday, folks. Historically, if you look at the previous Good Fridays, the volume does drop and whatever. So it's considered a cultural holiday. So we're gonna keep it as a holiday schedule in that regards, folks. Some of the things have changed on the schedule. Please look at the schedule. I have notes to talk to Angela about April the 4th, and I just saw Angela here. All right, Angela, have you seen this? I'll tell you right now, I need you to in at 8 o'clock a.m. for April the 4th. Take a look at that schedule. That's a Tuesday. Katie, see me, and Andrea, see me about schedule changes, okay? We'll go from there. So we got the Good Friday out of the way. As far as Driscoll furloughs, when I say Driscoll furloughs, basically the baby is coming down from the 5th floor to MRI or to CT or for an MBS. As a reminder, at the end of those examinations, right-click impacts and send to Driscoll, to their life image. And what they do is they receive them at Driscoll, and they put them in their, and they store the images in their just NCC as they call it. So nevertheless, as a reminder, any patient that is coming down from the 5th floor, we're treating it as a furlough. Right-click and send to Driscoll. Another topic, I was talking to AJ, he was talking about the UV error that he was getting a lot. He was having to troubleshoot that a lot. So guys, talk to AJ about that. And if there is something that we can do on our side, if there's a quick fix, look at that UV. From what I understand, correct me if I'm wrong, once we get that UV error, it was supposed to be a one-time thing. And once you fix it for your mnemonics, it does not happen again. But let's double check that. So if anybody, my super users out there, let's share with me what that UV, if it's a one-time fix or what have you. So we're done with the Driscoll furloughs. Right-click furloughs. So I'm going to put that away. In four times. I'm going to put that back in the box and everything. Folks, as a reminder, and I'll remind that'll be for May YouTube Huddle also, but as a reminder, if you're going to submit any timekeeping issues or on-call shifts for anything, you must put them in N4. Address them to myself and to Melissa. You can't just shoot them off to Melissa, or you can't just be walking into MRI and tap Melissa on the shoulder and say, hey, I need you to put me on call, And don't expect Melissa to turn around and open it up N4 and put you on call. That's not how it works. We have to follow a process, folks. You have to put those in N4 for my protection and for Melissa's protection, so that we can do it right and follow policy. Please put it in N4 if any on-call shifts. If it's on the official schedule and you're already slated to be on call, I will forward that to Melissa and give her a directive to put you on call. But as far as sometimes when we switch calls or we cover each other, what have you, or we have a need for additional personnel on call, can't just verbally tell Melissa. You've got to put that in the N4, address it to myself to include Melissa, and then it's official once I give Melissa the approval. So that's just as a friendly reminder to help us continue being straight on that policy. All right, folks. Let's see here. Looking at this note here, everybody gets an email when it's time to do that TB questionnaire. Okay, please, if you get an email, check your emails, folks. We're getting a lot of folks who are getting close to the, hey, it's your N95 fit test. It's due, or it's past due. We can't do that. We've got to get these done before your due date, okay? What happens is if you're working past due, I get alerted immediately to saying, okay, you must get put it in writing that you had a verbal conversation with your associate stating that they were past due and they cannot work until they get that completed. So to prevent any type of documentation for being past due, I ask everybody, check your emails. And if you're due to get your TB questionnaire done on Ready Set, knock it out, please. If your BLS is due, knock it out. If your ART is due, renew that on time. What N95 fit test is huge also. So check your emails. I do my best to try to cascade those to y'all also. Let's see here. We had a couple of times issues where Dr. Tan was basically in medical records. He was basically given several notice like, hey, Dr. Tan, you have to sign this patient's chart. And Dr. Tan, as a radiologist, does not have patients or see patients as a clinician or as a provider. He's a radiologist. So after further investigation, we have found that when we're putting orders in, somehow or another, they default to Dr. Tan or Dr. Moody, for example. So most importantly, folks, if we are putting a verbal order in Meditech, do not use our radiologist. It has to come from Dr. Trevino, Dr. Crocker, or the ED physician. We cannot use a radiologist. So what happens if you use the radiologist, it triggers a Meditech message to them to sign this patient's chart. They don't sign patient's charts, folks. They deal with radiological reports only and electronically signing in the radiology world, not in the provider world. So most importantly, if you're putting a patient in, it's under a verbal, you cannot use our radiologist name. You must use the attending physician's name. Now, if they have a written order, you don't use verbal, use written, especially for outpatients, okay? So with that being said, folks, that's it for this Sunday's edition of a special YouTube huddle. Coming, not special, but I had to do it on Sunday because come Monday, we're going to have some kinks to work out with our South Texas, not South Texas, Christus South Surgery Center. That's basically, we're absorbing they're going to follow our format, and those 4 or 5 very fine techs over there are needing our help to know how to PACS and know how to Meditech. So with that being said, I had to get this out in a timely fashion so tomorrow there's no confusion as to what is our role. More to come on that, folks. Have a wonderful Sunday evening. Talk to y'all later. Bye-bye.